Hi, Dr. John Torres here in my Doc to Doc series, where every week I talk to an expert around the world about medical issues, about health-related issues. And over the last couple of years, it's been about pandemic-related issues, but we're going away from that to a certain extent and talking about things that affect your life. And right now, nothing seems to be affecting people quite as much as seasonal allergies. They seem to be hitting faster, harder, earlier, and people are complaining more about them. So we want to find out a lot more information. And to help me, as always, I bring an expert along. And this time, we have a very good expert here, Dr. Kari Nadeau. She's one of the nation's foremost experts in adult and pediatric allergy and asthma. She's the director of the Sean Parker Center for Allergy and Asthma Research at Stanford University, and she's an endowed professor under the Nadeau Family Foundation. That's a research group that she follows, resides in pulmonary and critical care medicine. Kari, thank you very much for being here with us.
Thank you. It's a pleasure to be here, John.
And for those who are very astute, she is in a car, but she is not driving. Is that right, Kari?
That is right.
Excellent. Thank you for being here with us and for taking the time, especially in the middle of your drive here. And I know that time's critical for you, so we'll get right to it. But let's start off with allergies right now. And let's just start off with essentially, the basics of basics. What are allergies? What happens inside our bodies?
Sure. Allergies are not easy. They're quite disabling. And for those of us who have them on the planet, they're not fun. And it's 1 out of 3 people around the globe. And this season is a tough season, and they're increasing every year because of climate change. But what happens in the body is you have an allergy to, let's say, a pollen. That pollen is kind of sight unseen. It's really small, and you breathe it in, or you eat it, or it might be an allergy to, let's say, an insect, so it might sting you. But the process is the same. The pathway is the same. Our body says, I don't like you. You're foreign. Something's wrong here. And because of that, it's on the attack. And what happens is the first chemicals in trying to attack that foreign substance, like a pollen, is a chemical called histamine. And you guys will recognize that because a lot of people take antihistamines as drugs, but the histamine makes you itch and red, and you get an itchy eyes, itchy nose that swells up. You make a lot of mucus, and it gets congested in the lungs. You can't breathe. It's not fun to have allergies. And that's what happens is these little molecules get into your body, and we see them as foreign, and we make another molecule called IgE. And that's what we test oftentimes when you go to the doctor. But IgE is the match that lights the fire behind that histamine surge. And that histamine can happen within minutes. So it's also a very fast reaction.
And it's interesting. I never suffered from seasonal allergies, and a lot of people in my family would, and I'd always tell them, "Oh, come on, it can't be that bad. It's not that bad. Just deal with it. It happens every year. You have to be used to it by now." And then moved to Colorado, and I started suffering from allergies. And it turns out I'm allergic to juniper. And after the first couple of seasons, I was like, "How'd you deal with this? Oh my God, this is like horrible." Because I would just, like you said, scratchy, itchy, fatigued. I would just get really tired. And can people grow in and out of allergies?
John, it's a great question, because 1 out of 3 people on the planet have allergies. Yes, they can grow in and out of it. And that's the problem. When you're a child and you don't have allergies, you think, oh, I dodged the bullet. I'm not going to become allergic. But actually, a lot of people now in their adulthood get new allergies, especially like you, when they move into a different place. And you probably hadn't maybe seen too much juniper before. But when people have allergies, you're absolutely right. It makes you really tired. It's like you're running a marathon a day because your body's trying to attack what it sees as a foreign item. And this is kind of gross, but it might be interesting. People actually have studied how much mucus a day you make when you have allergies. And you can make, as an adult, up to 1 to 2 gallons a day. That's what also makes you very tired.
Wow. And anybody who's had allergies, myself included, will tell you it feels like that, because you're just, Kleenex box after Kleenex box, and pretty soon your nose is getting raw and you're tired of it. And allergies, we talk about a lot of symptoms: the itchiness, the scratchiness, the watery red eyes, like you mentioned, the high mucus production. Do allergies make you cough? Because right now, especially in the middle of the pandemic, that's one of the things, what's COVID, what's an allergy?
That's right. It's a great question, John. So yes, when you have that mucus going down your throat, that can make you cough. And as well as it can go down the really tiny spaces of your lungs that look like little grapes called alveoli. And that can also make you cough because they kind of irritate that part of your lung. The same thing happens with COVID or a virus. That virus is seen as foreign. And so your body makes mucus to slip and slide and try to remove things like pollen or virus. Those same processes happen. However, with a virus, you typically have muscle aches, you have a fever, you have other symptoms in COVID, like maybe loss of smell. That does not happen with an allergy, for example. So fever does not happen with an allergy. Headache typically doesn't happen with an allergy. When you have those types of things like muscle aches, fever, headache, that's more like a fever caused by a virus.
What I've been telling my patients and the viewers is, essentially, if you have allergies and your symptoms are the same every year and you're having those same symptoms, you can probably rest assured it's allergies. But if they change even a little bit and you're having those symptoms that you're talking about in particular, assume it's COVID, get tested. And then once if it's negative, then start looking at allergies. But we're in a pandemic, so you have to think COVID first.
You're absolutely right. Always make sure that you don't have COVID, even if it's just a little mucus, a little congestion, you don't have a fever, make sure you get tested first.
Asthma. Now, asthma is becoming a bigger issue as well. Do allergies play a role in asthma, either people developing asthma or exacerbating their asthma symptoms, or both?
Yeah, unfortunately, about 70% of people with allergies will have asthma at some point in their life as well, because when that mucus goes down your lungs, it starts to really irritate the lungs. The lungs don't like it. All that mucus has to go somewhere. It goes down your esophagus to your stomach, makes you feel like you're really full, or it goes down into your lungs, or both. So when it goes down into your lungs, which often happens, you get asthma. And asthma is very dangerous. It can start having wheezing. There's also asthma associated with exercise. There's also asthma associated with allergies. But most importantly, it's not fun to have, because wheezing and constricting of the lungs can lead to inability to get air in. And you need to see a doctor right away, because there are medicines that really help. But asthma is very frequent in our population across the globe, and things like air pollution can make it worse. So when you think of people that have allergies and asthma, they need to make sure they go see their doctor and avoid other exposures too.
It seems like allergy season, and I get a lot of people asking me this question, seems to be starting earlier, seems to be lasting longer, seems to be hitting harder. And I know there's an article that Stanford Medicine just came out with that you had took part in, and you talked about how even over the last 20 years in the Bay Area, we've really noticed this increase in allergies, both seasonally and intensity. And that looks like even moving forward, it's going to be a big issue. Is that true? I mean, basically.
Yeah, John, thanks for reading these articles too, because we are doing a lot of science, not just our lab at Stanford, but also many other labs across the world. But I think we were all noticing as doctors that our patients were coming into us more and more frequently and saying, hey, I don't typically get my nose itchy and eyes itchy in January, but for some reason I am. And I see the oak trees are blooming now. And this is in California, for example. And we're like, wow, that's true. These trees that otherwise never bloomed before are starting to bloom, because with climate change, with warming of the planet, we're seeing the seasons of pollen allergies, for example, increase by about 2 months. And that's a problem for allergen sufferers. Now, it's just not trees that are pollinating earlier because of warming in a climate. It's also like ragweed. And because places are getting warmer, places like Norway that never had ragweed plant before now have ragweed plant because it can grow there. And so there are now countries that are experiencing allergies to pollens that they never otherwise had. So I think it's a problem that we really need to make sure we address, and that we can manage for our patients and then also manage for our planet.
And you bring up a good point. Let's say you're allergic to ragweed, which typically happens in the fall, correct? And you start getting symptoms in the late spring, early summer. Could ragweed have moved into that position? And are the seasons not as defined as they used to be?
Excellent question. Yes, now the seasons are becoming blurred because pollens can travel 2 miles. People that try to get rid of trees in their yard, or they try to get rid of grasses and replace it with turf. It really doesn't matter because these pollens are so small, they can travel in the air. So a lot of times now throughout the world, we're planting plants that otherwise were not native to that region. And so because of that, pollen season happens at any time in the year. Now, if you have a freeze-thaw cycle, or you live in Denver, for example, there are certain things that just can't grow at elevation. But you're absolutely right. Now the seasons are becoming blurred. There's not really a perfect season for pollen anymore. You really need to talk to your doctor and then make sure that you manage your allergies, because management of allergies up front can decrease the second side effects like sinusitis and asthma.
This is great because things that in medicine often turn into dogma, we need to make sure from time to time that they're still accurate. And one of the things I always talk about is, trying to get ahead of your allergies, trying to start when the allergy season is starting and taking, there's a lot of over-the-counter medications right now. Like you said, the antihistamines, the non-sedating antihistamines, the nasal steroid sprays. Is it important to start early?
Yes, I really think so. I see that in my own patients. If they can start early, when they have a really good signature of what they know those allergies are to, and that can be done with skin testing, that can be done in an allergist's office, then you find out what you're allergic to. And then what they can do is go on a website, and I can give you that information. And there are many websites that track pollens in different areas. So they know ahead of time, wait a minute, the grass pollens are starting to increase today. I better go to the local pharmacy and buy my antihistamines so that the mucus doesn't become overloaded, because you don't want to be reacting so much to your allergies as much as you want to be proactive and make sure that you can decrease that mucus, decrease that itchy eyes, itchy nose. Because if you can start early, it can really prevent some of the bad side effects like sinusitis and asthma.
And how important, you mentioned it, but how important is it to check those pollen counts? Like you said, they're readily available.
My patients really enjoy checking that, and they are readily available. It really helps them manage because they change every bit every day. So if you start seeing a pollen becoming in the low category, you know that it might have a trajectory or pathway to become medium the next day. So that's when I start saying to my patients, start buying your antihistamines, nasal sprays, and your inhalers if you have asthma, just to get ahead of it. And it really does help.
And besides the over-the-counter medications, the medications your doctor might give you, what are things people can do at home if they know pollen is going to be high to try and keep their symptoms under control?
Yeah, absolutely. We also like to make sure that we can minimize medications and maximize effect. And so most importantly, with knowledge in hand, and that knowledge is brought to you by places like here where we're having discussions, but also with doctors' offices and other media. But importantly, is you could go into your home, make sure you have a good air filter. And for example, there's a filter called MERV 13. And for people that can't buy that, for some counties, you can actually have it brought to your house for free. There are programs now where you can get these filters, and they really do help. There are a lot of air filters out there that don't help those. So it's really important to make sure that you talk and as a consumer, look at which of those filters really do get out pollens. But MERV 13 or higher grade will get out those pollens from the air. So going into the house, making sure that you can be careful if there's a high pollen outside, if there's a high pollen count, try to avoid that. Don't exercise outside, exercise inside. And then if you have children with allergies, you can do the same. But those are types of behaviors that you can avoid getting exposed.
And I always talk about washing your hair before you go to bed, or at least rinsing it off, because it becomes kind of a pollen sponge. And if you have pollen in your hair, get it on your pillow, you turn over, your nose gets in your pillow, you're just getting a nose full of pollen. Does that seem to work?
Absolutely right. For people that have pollen allergies, they can make sure that they don't wear the same clothes twice, especially if you're outside. Don't mow the lawn. If you're the person that's mowing the lawn, please have someone else do it if you're grass allergic. And then change your clothes, wash your hair, wash your face. Those pollens are very sticky. If you actually look at them, they have little spikes on the outside of them. And so they like to stick onto things like you're saying, John. And washing and then changing before you go to bed, really good idea.
What about, we often hear the words hypoallergenic or hyperallergic. or allergenic products. Are those worth it?
I think you have to be really careful. There are allergies, and mostly when we talk about allergies, John, to seasonal allergies or to foods or to animals, what you're allergic to is the protein. But there are some people that are sensitive to chemicals, for example, like things like that you use on your skin, like lotion. And if it says a hypoallergenic lotion or cream, that means that they probably don't have a lot of those sensitive chemicals in it. So for people that have sensitive skin, yes, it's worth getting hypoallergenic products, but be careful. Make sure you look at the ingredients, make sure you talk to your doctor, try a little test on your skin before you put it all over your skin, because there might even still be a chemical in the hypoallergenic formula that still irritates your skin. But now let's move forward with hyperallergenic animals, because there are animals that have hair, not fur. They don't turn over their fur as much, for example. They will call them hypoallergenic dogs or cats. But no matter what, they still have allergens associated with them. They aren't completely devoid of allergens. So I just want to make sure when people buy those hypoallergenic animals, just buyer beware, because you still might have a little allergies, maybe less, but it's still there.
I want to switch topics here just a little bit and talk about food allergies, because that's a big issue too. Is there a difference between food allergies and food intolerance? And gluten is the main one that people, I think, get confused often.
Excellent question. So yes, there's a difference. When we talk about wheat sensitivity and gluten sensitivity, if when you eat wheat, that makes you bloat and get a headache, feel uncomfortable, that's most likely a sensitivity, and you should go talk to your doctor. You just should try to think about gluten products that might be better, or gluten-free products that might not irritate you. But that's a sensitivity, like you're saying. An allergy to wheat is very different and very rare. What happens there is any allergies typically happen in the first 2 hours, and that's either pollen exposure, animal exposure, insect exposure, venom exposure, or food. And so with that little molecule, IgE, recognizes the gluten molecule, and you start having itchiness and itchy eyes, runny nose, asthma, or abdominal pain. That's what's associated with a wheat allergy. And there are people with wheat allergies, and it's not fun at all, and it can be deadly. And so any food allergy can be deadly. And so that's why we take special precaution to make sure people understand, are you allergic to wheat or are you sensitive to wheat? Because those are two very different things. There's also celiac disease, which is more of an autoimmunity, and that also has to be diagnosed formally by a doctor. And that's more of a sensitivity, but it can also be life disabling.
When I went to school, this is many years ago, especially elementary school, middle school, I don't remember a single person that had peanut allergies that we had to worry about. And now it seems like every school I've been involved with, through my children or through other issues, there's always people there, children there that have peanut allergies. So it's definitely been expanding over time here. Peanut exposure has been one of those issues too that has kind of gone back and forth. What are we looking at now? When should children be exposed to peanuts, and how?
A great question. I love the fact that you're already thinking about prevention, John, because if you're absolutely right that throughout the world now, about 7 to 8% of the global population has food allergy. And at some point in their life, they might not have it as a child, they could get it as an adult. Most of those food allergies, if you ask China, it would be milk and egg. If you ask Japan, it's milk, egg, and fish. If you ask Ukraine, it's carrots. If you ask Italy, it's hazelnut. If you ask America and the UK or Australia, it's peanut. So we do have to worry about peanut allergies, as you said. But we think that the reason for this increase around the planet, and it's doubling every 10 years in some countries, is because of sort of exposures. There's environment and genetic components to it. But there are therapies now that are available, and that's great. And we need to think about that. And many people have allergies outside of just peanuts. So a lot of people have more than one food allergy, about 45% of people do. But because of that, we really need to think about prevention. And what my colleague learned in the United Kingdom and many people around the countries, and when I was talking to many countries who have food allergies, I learned that the countries that have the least food allergies are those that diversify their child's diet really early and often, and in infancy start to give their children a lot of different food proteins. And there's about 9 proteins around the world that are highly allergenic or seen as food allergies. But if you could start them early, around 4 to 6 months of age, feeding little bits to the baby, that can actually educate their gut to say, whoa, wait a minute, these aren't foreign, these are natural, these are proteins I'm supposed to take for my nutrition. So we've learned a lot in the past 10 years. And like you asked, what we really want to do is prevent food allergy. And if you start between 4 to 6 months of age, eating little bits of peanut, little bits of fish, little bits of milk and egg and wheat and other tree nuts, that can really prevent food allergies in the future. So that's exciting that we have that knowledge now to help parents and to help people.
Thank you for that information, because again, it's a little bit confusing as to when you should do it. You're saying 4 to 6 months, and there's a variety of proteins to start introducing. And like you mentioned, we're talking small introductions, not full meals of food. So
that's right. Yes, it is exciting that we know that now, and a lot of it has to do with the immune system. Just like we learned a lot during COVID, and you've had such great sessions on your show here about how our immune system can redirect and purposely help us be protected against COVID. In the same way, we now know how to tap into our immune system and every day give it a little bit something to eat and teach that immune system that these foods are not foreign, that these foods are natural, and these foods are not meant to have an allergy against. And it really helps, I think, and hopefully we'll be able to prevent food allergy.
And the last question I'll ask you, and it's unfortunately, it's a very complicated question, so I don't know if there's a simple answer to it, but there's that hygiene hypothesis. Are we keeping our kids too clean? During the pandemic, it's a different issue because, we talk about washing your hands all the time, using hand sanitizer, but pre-pandemic, there was that thought that we might have been doing too much of that. Do you think so, or is that kind of a not accurate?
Well, there's the reason I'm going to answer this question. It is complex. You're absolutely right. But my thinking is based on data, on evidence. And that's always important to make sure that when we talk as doctors between each other, we're basing our discussions on really rigorous science that was based on a lot of data, not just one person's group, but a lot of people. And then they basically convene and talk about it and say, okay, this is right or wrong. Right. But importantly is, yes, for COVID, we absolutely have to practice good hygiene. That's critical to make sure that virus doesn't get to other people or to in the air. But for the risk of food allergies, we know, and just like with COVID, we know that if we have certain good gut bacteria, if we have good practices of eating fermented foods, for example, that allows the gut to be ready to what we call tolerize, to be educated, to be able to see those foods as natural. So yes, there is this importance to be able to have good bacteria, not bad bacteria or bad viruses like COVID. But we have to tell our guts how to eat well. And that's important for nutrition. I'm a pediatrician, so I love talking about nutrition and prevention. So having good fibers, eating a lot of good green vegetables, making sure that we have the right environment for our gut to accept good microbiota. That's, I think, what we talked about with the hygiene hypothesis. They noticed very early on in Wisconsin and in East Germany when the Berlin Wall came down, that people that were living in farming communities and that were living with a lot of animals didn't have a lot of allergies. And that's why this hygiene hypothesis came about. But now we need to use it. We can't all live on farms. We can't all live with tons of animals. So now we need to use it to instruct our behaviors to eat the right foods, to do the right things for nutrition, to be able to try to be part of that prevention of allergies.
Excellent. Thank you very much. I appreciate it. You cleared up a lot of things here. We could talk for about another 6 hours and get more cleared up, but unfortunately, we don't have time for that, but I appreciate it. Thank you very much for your time here. This is Dr. Kari Nadeau. She's one of the nation's foremost experts in adult and pediatric allergy and asthma, and the director of the Sean N. Parker Center for Allergy and Asthma Research at Stanford University. Kari, thank you very much. And again, for people who tuned in a little bit later, she's in the car, but she is not driving. So she's being safe and very informative, but I appreciate it.
Thank you so much. Have a great day, John. And I hope your allergies get better.
Me too. Thank you. I appreciate it. I think they will with this conversation.
Wonderful. Have a great day.
You too.